I'm Jen Harper from the Boys and Girls Club of Greater Derry. I've worked here 26 years. I've been the CEO now for almost 2 years now. This club has been around, this actual building has been around since 1983, and this club used to be housed up the road, but we've been in existence for over 50 years now. For kids in most of southern New Hampshire, Derry, Londonderry, Auburn, Hampstead, Chester, all the way to Plastow. We service about 1,500 kids a year here. They can come here for our after-school program, for our summer program. We have high school programs in the evening. We have leadership programs, not just a recreation summer camp, but we offer a lot of character building and social, emotional activities here, educational activities for kids to grow and have a safe and positive place to be. Medicaid changes that are going to be happening this summer will affect a lot of our families. We want to be able to support all of our families as we can, so that's why we're offering this info night, so that we can all learn about all the changes that are coming. I'm going to turn this over to Deb now, who's right here.
Hi, everybody. We're just gonna
I think it just needs a minute to warm up.
warm up. I'm Deb Fournier. I'm the Director of Health Law and Policy at the Institute for Health Policy and Practice, which is a little tiny think tank at the university. I'm a former Medicaid Director for the Great Granite State, and I've been at the university for about 6 years now. I can also just do the arrows myself, like it's totally fine. Or not. Oh,
I think it went to sleep. There we go.
okay.
Yay.
So I'm here to talk about the changes coming to Medicaid. And I can make this a 40-minute presentation, and I've been asked to make it a 10-minute presentation. So I will do my absolute best to stick to that. What we are really here for is to hear your questions and concerns. I'll just tell you up front, we don't have a lot of specifics yet, but we want to know what you're worried about. We want to know how this information comes across to you, because there's a lot of changes coming, and we really want to make sure people have as much information as they can to keep as much coverage as they can for as long as they can. So we're going to really quickly, in a very abbreviated way, talk about what Medicaid is. We're going to talk about some of those new laws. There's 2 in particular that we're going to worry about, and the changes that they make to Medicaid in New Hampshire. And then some very preliminary what you need to know right now. Okay, so Medicaid is our publicly funded health insurance program for low-income people. It was created the same year that we created Medicare, so it's 60 years old, 61 years old now. And these 4 groups are the traditional groups of people that Medicaid covers. You have to be low income and a baby or a kid, a mom who's expecting, an older adult, 65 and plus, and a person living with a disability. In recent years, meaning the last 10 years, Medicaid added another category, which they're called the expansion population. So that's just low-income folks who are 19 to 64 who didn't fit into any of those other categories. Okay? So they're just, and you can be employed full-time at the federal minimum wage and have income below the poverty level. So we added those low-income workers, and that is, in very broad terms, who we cover in Medicaid. And we provide very traditional health coverage services to them. And the really special thing about Medicaid is that it also provides long-term care services, home and community-based care services for people that generally aren't available anywhere else. That is not the focus of our time together tonight, okay? Okay, so we have these 4 people and we have the expansion population, and now we're gonna look at this pie chart that shows enrollment in New Hampshire Medicaid as of January of this year. And I tried to clump them together and realized that the writing now is very small probably on those labels. So the orange slice of the pie, those are low-income babies and kids. So about 49% of all the people in New Hampshire that we cover with Medicaid are children. The red slice are those expansion adults, those low-income, 19 to 64 people. So they have income, if they're a person of one, a household of one, they have income under $16,000, probably around $15,900, I think. The dark blue are our older folks and people with disabilities. They make up about only 14% of our overall Medicaid population. And then the light blue are pregnant women, former foster kids, very, very, very low income adults. And then we have a little tiny slice that are kids who are disabled and receive supports at home before they are school aged. Okay, so that's everybody. And right now, the total number of people is about 175,000 people. So the biggest slice is orange. Those are kids. The red slice are the expansion population. And you want to remember the red slice because they are the target for most of the changes coming. Okay? All right, so we have these 2 new laws, the state budget and OBA, One Big Beautiful Bill Act. And they have changes that basically frustrate enrollment. So the state budget requires premiums to be applied to those expansion adults. It requires premiums to be applied to some families that have slightly higher incomes. And it requires that the state proceed with work requirements. The federal law, OBA, requires the same things, work requirements and more cost sharing, but it also doubles the frequency of how often people have to renew their eligibility. Right now in Medicaid, you renew your eligibility once every 12 months. Going forward, the red slice, the expansion slice, will be the slice that has to double its eligibility renewals to twice a year, but also is the subject of paying the premiums, the cost sharing, and has to fulfill the work requirements. Okay, so the red slice, that's the slice that will get the first changes, which are the application of premiums. That's in the state budget, and those are only for the people at the very, 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 very highest end of that income group, which is why it's not the entire red slice and just a part of the red slice. And then the orange slice are the proportion of those families with kids that have slightly higher income that will also have to pay premiums. These are supposed to come online in July of this year. I haven't heard that that is not going to happen, but I don't have any confirmation that it's going to be on time either. Does anybody have a question? I don't have to speak to this. You guys can stop me. All right, I'm gonna keep going.
Yeah, I got a
Oh,
question.
yes.
I'm sorry, my mouth is full.
No, no.
Oh, I have a microphone I can bring to too, so we have people live streaming.
Okay. Oh.
Here you go.
So my question is that I was talking to someone that I know in our community whose parents, because of disability, are on Medicaid, and she didn't seem to think that they'd been informed or they didn't know anything. Are people being informed if they're going to be faced with increases or with premiums?
So I don't know. Any notice has gone out to people about increased premiums. What I can tell you is that the premiums from the budget only apply to those expansion adults, so not disabled, not pregnant, not
Oh, I
disabled,
gotcha.
not in any other category,
I got it.
okay?
Thank you.
And those very high income, they're called CHIP families, Children's Health Insurance Program,
Okay.
which is like an add-on on top of typical Medicaid eligibility. Yes, ma'am?
Is CHIP different from expanded Medicaid for children?
Yes. So, yes. So for the orange slice, that's the CHIP families. That's for families whose kids qualify for this add-on to CHIP, Children's Health Insurance Program. And they have to have incomes at 255% of the federal poverty level or above. So for one person, 255% of the federal poverty level is right around $39,000. Okay? So families at 39,000 and slightly above, the premiums will apply to them. And for the expansion folks, the red slice, the part of the red slice, the premiums applied are for those who have income between 100 and 138% of the federal poverty level. So that means people with income between roughly, I want to say, 15,000 and 15,900. Okay? So it's just components of those two. Everybody else on that pie chart who are grayed out, the older folks, the people with disabilities, the pregnant women, the vast majority of the kids, and the majority of the expansion adults, those premiums don't apply to them. But that's just the state budget, okay? So that's what's coming online. Third quarter this year. The changes for from the federal law, from One Big Beautiful Bill Act, all apply only to the expansion zones. So that's double eligibility requirements, that's work requirements, and those things both start in 2027, not before. At least as far as we've been told, the state could opt to start earlier. I haven't really seen any signal from the department that they are ready to do that. And then they will pay additional cost sharing for certain services starting in 2028, late 2028. Okay. So I'm going to go on and say Medicaid eligibility is weird. There are different eligibility income ranges for different groups. So for example, the people in the yellow on this, I didn't color coordinate my pie chart in this chart. The people in yellow on this chart are the expansion adults, right? So their incomes only go up to 138% of the federal poverty level. You can only make, what is that on this chart? $22,000 as a person, as a household of one, as a low-income adult. But if you are a baby or a kid in the medium blue, then your income can go up to, your household income can go up to more than $47,000, right? So, when we are talking about only proportions, certain slices of those pie slices, certain components of those pie slices, having these new requirements applied to them, it's largely based on where they fall in the income range in their eligibility category. So what the income eligibility category would be for me as a mom of a kid, for my coverage is different than the income eligibility range that would apply to my kid. It's really important for people with families because an important thing to understand is that just because if the whole family is on Medicaid, there are circumstances in which even if the parent or the guardian or the adult in the family loses their Medicaid coverage, the kid may still be eligible because their income goes up, what they're allowed to have for income goes way up beyond what mom or dad are allowed to have for income. Okay, so really want you to remember that because it's super, super important that just because mom or dad loses their coverage doesn't necessarily mean that the kids are no longer eligible. We don't have any details yet about how people are going to fulfill their work requirements. there are a lot of potential exemptions, but we don't have any details yet about how exactly those exemptions are going to be defined. And probably the most important thing is, on both sides, is if people do have an exemption, how they demonstrate that, and if people don't have an exemption, how they demonstrate that they're meeting the work requirement, right? Those are the big details in my mind that we just don't have yet. Okay. The other weird thing about work requirements is that if somebody in the expansion, in the red slice, right? If you lose your Medicaid coverage because of the work requirements, because you didn't comply with the requirements one way or the other, it also automatically bars that person from getting financial help and buying a plan on the marketplace. So complying with the community engagement requirements, the work requirements, is super important.
Deb, can I ask a question?
Yeah.
That I think is coming up. Medicaid expansion is also known as the Granite Advantage
right.
program. So if you are, if there's a recipient of Medicaid, if you're concerned about a population of people who are not receiving Medicaid through Granite Advantage, then there's less to be concerned. I think that sometimes people are concerned about, what does that look like on my ID card?
Right. So I do have pictures of the insurance cards. We don't need this slide. This is just about how enrollments have fallen in the healthcare.gov in New Hampshire. And here's, again, the timeline. The bold-faced items up here are the things that we've just talked about. The application of premiums and the application of work requirements. And remember, for the vast majority, they only apply to the red slice of the pie. Okay? So, what do you need to know? If you have an insurance card that has one of these 3 logos on it, you or someone in your family is covered by Medicaid. Okay? You can call your health plan, you can call the department and find out if you are in Granite Advantage. That's the brand name for the red slice of the pie. Mostly families are covered all by the same, but you don't have to be. You could choose a different plan for your kid than for yourself. Okay, so any 3 of those. The other really important thing is, in order for the department to share with you any information about what you need to know, your contact information needs to be up to date. Please contact them and make sure that they have your most current snail mail address and email address and phone number. Super important. If I had to prioritize one of those, it's your snail mail. Make sure they know how to find you via the mail. Wherever that is, wherever you are receiving mail, make sure that they have that accurate information. The other thing is, this is basically my hurry up and worry presentation. Stay connected to Medicaid Matters, which is this coalition of folks who's working to make sure that people are informed and understand the changes coming. And they will be able to push out information perhaps more rapidly than the department will, once the department makes a bunch of programmatic decisions about how it's going to apply these changes to the program. So stay connected to them and check in on them often so that you can get updates when you need to. Okay, so now is the time for more questions and discussion. Thank you for listening. I don't mind repeating anything. There's no dumb questions, no bad questions. If you're thinking it, 5 other people in this room are thinking it, for sure.
So true.
It also helps us to create frequently asked questions for the Medicaid Matters information sheets and our website, so that if your question gets aired tonight, like maybe that's a question a lot of people have, we can add it. So
It
that
also helps us go to Medicaid in New Hampshire and say, we are hearing X and Y and
Correct.
Z a lot from people. Can you give us more information about that? And if you don't have it, can you can you get some?
Want to start?
Sure. So I just want to make sure, maybe I'm misunderstanding, the 6-month readies?
Yeah.
Is that just within the Granted Advantage population? What about the other Medicaid recipients?
Yes, it's just for the Granite Advantage population.
Really?
Yeah.
Well, I misunderstood that. Thank you.
Yeah. Yeah, you're looking at me like, maybe not.
I'm shaking my head, I agree.
Okay.
Kathy, did you have anything you wanted to say tonight?
You know, I guess that by the way, I'm Kelly Cappuccino. I work for the Center for Life Management, but I worked with Deb for years. I've been DHHS. I'm a retired DHHS employee. I'm here really because Vic Bobo said, Kelly, people from our community are coming to the Boys and Girls Club with concerns, and I want to make sure that we know what their concerns are. We're supporting them as middle of filling 2 positions to address those 6-month redeterminations. And we will assist everybody or any family member that comes looking for help to get those readies done. The funny thing with readies is that, you know, just about the time you're done completing that and you get a decision, it's going to be time for a new readie now, right? In the 6-month rule. I guess the message that I want to give to you is that we're here to help. We run a very tight benefits ship over there, trying to make sure that people do not have gaps in coverage. My name's easy to remember. It's just like the coffee, cappuccino. You could always call and ask for me, but you could call and ask for a benefits person too, and we're always happy to help.
And the reason that these things are concerning to people is because anything that you put in front of someone's eligibility always creates a potential for there to be an interruption in coverage or a complete loss of coverage, right? So benefits and services were not actually taken out of the Medicaid statute because of the state law or any federal law. But these changes effectively frustrate enrollment, mostly in expansion. And the reason they do that is because the federal government pays 90% of the costs for that group of people. So depressing enrollment in that group puts money in a different column in the federal ledger. Okay? Again, no bad questions, no dumb questions at all.
Can you mention something, we hear the word reedy, and
Oh.
I don't know if people know
Yeah.
what
So
reedy
a-
is,
a
and then
reedy
how that would,
is
how that,
Department talk for an annual redetermination, known as readies, renewals. And it has been the practice since about 10 years ago, 12 years ago now, that almost everyone in Medicaid has to do their redetermination once every 12 months. So for this group of people, for this 52,000 people in the Granite Advantage expansion, red slice of the pie, they're now gonna have to do theirs twice a year, every 6 months. And it's based on their renewal date or their enrollment date. So it's not as though on a date certain, everybody in Medicaid is going to have to renew. It's not as organized or structured as open enrollment. Yes, ma'am?
Can you change your ready date? Because mine falls on, I think, the beginning of the new year, and there's just so much happening
Right.
at Christmas, my kid's birthday, and I
Right.
literally go into uber stress mode.
Yeah.
So is there a way to change the date?
I want to say yes, but I don't know.
'Cause
And
that would
Cap,
just
I'm
be
gonna
beautiful.
see, I don't think there is.
Oh.
Yeah.
Okay.
Yeah, I think,
Yeah, I guess
But I'm
Salem
gonna
would have
take
done
it away. And
yeah,
I'm also the co-chair of the Medical Care Advisory Committee, which, and by the way, I'll put a plug in, they're always looking, they have a Consumer Benefits Advisory Committee now. They're always looking for people to inform things like that. So I'll take that away and I'll bring the information back.
Thank you.
just a couple quick comments. Changing the Medicaid date. You can call and you can ask, that doesn't mean they'll say yes. But I know myself helping someone who was in the hospital, they did push those dates out, and then we passed the ready date, and we called and said, we can't get in his apartment, we can't get what he needs, there's no way to do this, and they did push it out, and now his new ready date is that. So it couldn't hurt the phone call. That doesn't mean they'll do it. And then my PS to your question on the twice a year, my understanding is the 6 month is telephonic. Do you know that for sure or not?
So unless there's a different change, renewals always have to be available by those 4 main pathways: in person, online, by mail, or telephone. I have not seen anything that would suggest that it's restricted to only telephone. But again, we will take that back. Yeah. Anybody want to see any of my pie charts
We
again?
have a few questions
Oh,
that
okay.
that come up a lot that we.
Yeah, no, let's do it.
So if someone is on Branded Advantage, which is also Medicaid expansion, and they are active in treatment for substance use disorder, will they have to comply with the work requirements?
So my last reading of the statute is that having a diagnosis of a substance use disorder is grounds for an exemption from the work requirement. Again, there's a federal statute that says this, then there's one note from the federal agency that is in charge of administering it, and I haven't seen anything official about the details since then. So, based on what I've read, yes, if you have a diagnosis of substance use disorder, you should be exempt from the work requirement.
And you've already covered this, but I don't think it hurts to reiterate it. Our work is affecting everyone on Medicaid.
No, they are applied to the expansion adults. So the kids, the moms, people with disabilities, the older adults, people who come into Medicaid through any of those other eligibility pathways, the work requirement is not applied to them. It's for low-income adults, 19 to 64, who aren't otherwise eligible in Medicaid, and they make, if they're a household of one, they make about $22,000, between $15,000 and $22,000 a year.
Deb, you mentioned the exemption to the work requirement for people with a substance use disorder.
Yeah.
I know there's a lot we don't know about the exemptions, but could you outline some of the other groups that might be eligible for an exemption?
So people with disabilities, children, people with kids under a certain age. I think it's, I want to say it was 14, but I don't quote me on that. It's 13 or 14. I just don't remember which one. People who are considered medically frail, and that is a big opportunity because how you define medically frail will, in some ways, populate who is exempt. People that are in school to a certain extent, people that are caretaking to a certain extent. These are, sorry, I'm just giving very broad strokes. Did I already say people with disabilities and older folks? Okay, and kids, and pregnant people.
Maybe you said this. Do you know how many hours the work requirement?
So we have a disagreement between what the federal law said and what the state law said. The federal law says 80 hours a month. The state law says 100 hours a month. The people in government are trying to align those, get those things straightened out so that there's an agreement about which one it is. But I don't know yet which one that's going to be. This lady right here had a question.
Yeah, I have. Thank you. I have one more question. So in our community, I'm from up north, 19% of our residents receive Medicaid benefits. Is there any way to figure out what percentage are Medicaid expansion?
Yes, there is. That is very knowable information. I know we can do it county by county, but I'm sure we can do it town by town. It's just getting a data request into the department. But yes, they should absolutely be able to tell.
Okay, so who would I get that from?
Well, I think you need to stay connected to Medicaid Matters, and we'll run the data request through the department.
There you go.
Yeah.
Perfect.
Thank you.
Yeah.
Not everybody's as lucky as Salem to have someone who understands.
That is true.
I'm wondering if there's a plan for human
resource centers, hospitals, other mental health centers to help us support families when they're coming in to do all this?
So I do think that there are conversations starting now about a navigation service for work requirements. I know that the state is investing in a lot of technology so that the exemptions and the eligibility for or meeting the requirement can be as automated as possible based on existing electronic sources. But I know that there are many people asking the same thing you are, and that there's a lot of, I think people want there to be a navigation service so someone could get some, you need to submit this pay stub, you need to do it this way on this day. But I haven't seen anything yet about a concrete plan, but I completely agree with you. It would be a great asset.
And Deb, that would come from the state, like we could put something in for the state law to approve budget.
It doesn't have to be through the state. It could be through an external funder. And, you know, our CHIP program started that way. A foundation was provided the seed money for the state proportion of the children's health insurance program. So it could be that it's constructed outside of government. But yes, if for the state to do it, they would have to get an appropriation. And they'd have to get the State House to say, yes, we're going to give you this money, and this money is specifically for that purpose. Yeah.
Yeah, I just want to, say for folks that over at the Center for Life Management, and really at any provider who's verifying your health coverage, it tells us that you're granted Advantage. So when we verify your insurance, it comes back in a big table, and I put it in Excel, and I filter it out every single week, and we say, these are our granted Advantage people, reach out to them this week. Put a note telling me that you talked to them, and if you did not, you will be hearing from me. And so, we have a process to do it, but certainly the tools are there for any provider to be able to give that same level of support. I think that what would be a little helpful is if you could at a high level, tell people, why don't we have some of these answers? And when might we? Because the real issue, and we keep saying, right, we don't know, is that the federal government's trying to figure out how they operationalize this.
For 50 states with 50 different programs.
Right.
Yeah, we're on
Right.
hold.
So there's supposed to be sub-regulatory guidance, which means a memo from CMS that's supposed to come out sometime. I think we were all anticipating that it would have been by now, but I do think that the state, I know that the state is awaiting more details from them so that then they can move forward with their own implementation plans. Was there another?
We have a live stream question.
Yeah.
So maybe I missed this, but how does someone know that they are on Medicaid expansion plan?
So, people probably couldn't hear it just now, but your provider, when they are verifying your Medicaid coverage, your provider can say whether or not you are in Grant Advantage. The other thing is you can call the Department of Health and Human Services and ask which eligibility category you are in, which is a great first step for people if they are wondering about which pathway they came through.
Here's a question. Who can people contact if they need help or have questions?
So, people should reach out to DHHS for all of their eligibility questions. Out to one of your health plans. Remember those 3 cards? If you're enrolled in Medicaid, for all of your short-term care services, no matter how you are eligible, you have one of these cards. They should know which eligibility category you are in because they get paid according to which eligibility category you are in. You can also call Medicaid Matters or go to the web page. I think I included the URL down there in the corner. I think that's a great place to get connected. Kelly Cappuccino did mention something. A lot of providers have application assisters. They have people in their organization who can help you with your coverage questions, whether it's a Medicaid coverage question or a healthcare.gov coverage question. And plugging into the people who are in the healthcare delivery system is always a good idea. But first and foremost, call the department and ask them.
I can also add that community health centers are also a good resource. And if you don't know where to find us, we are NewHampshireNeedsMedicaid.com. And as Deb said, we're in close contact with DHHS, and we have people that are keeping an eye on the forms and the questions that are coming into our website, and we do our best to get an answer back to you as soon as we can. So just don't hesitate to reach out. We also have a Facebook page and Instagram page.
Very 21st century over here.
Yeah.
Any other questions?
No bad questions, none.
I have a scenario, Deb, that I've had presented to me
Okay.
on the Medicaid Matters team. If a caregiver receives Medicaid expansion for their health insurance, in order to provide care to any dependent, elderly or child, who is covered on Medicaid and protected right now, that caregiver, how will they be able to prove the eligibility requirements necessary to be exempt from the work requirements?
Because they are a caregiver.
So how do you define a caregiver?
Yeah, I don't have a good answer for that yet.
Okay.
I know that adults with dependent children under a certain age, and again, I don't remember if it's 13 or 14, are in one of those exemption categories. I know there are other caretaking responsibilities, but we don't know yet about how that's going to be defined or what a person has to demonstrate. Like, is there a care contract? Is there a waiver admission so that it's validated that the person you're caring for is someone?
Yeah, it's been nationally debated how this will be determined.
Yeah, we don't know yet.
So, my understanding is that this will apply to kinship caregivers, so people who are retired. Am I correct about that?
So it's really about the eligibility pathway that they came into Medicaid through. If they came in through the Granted Advantage Medicaid expansion pathway, the work requirements apply to them.
Even if they're 75 years old?
No, because, but again,
Because they're over 60.
they're over 65, right? But
Any other questions?
Can I ask a question of the audience? Is that okay? My name is Jake. I'm proud to work with the Medicaid Matters group, and I'm wondering, is this conversation, the way this played out, is this helpful to you? Does it seem like it's relevant to your lives? Are there things that we can do to make this better or more understandable? We're hoping to do a series of these going forward. We want to make sure that we're making it as approachable and understandable to people as possible. So if you have any suggestions at all about how we can make this more relevant, more understandable, we would be all ears.
I have a suggestion. Deb should include the department's phone number on your slide deck. Deb should also include the phone number for Medicaid Matters and for the health plans on her slide deck. That would be a great first start.
One thing we do have though is in your folders, we have a variety of handouts. One is a definitions handout, so a lot of the programs we talked about, redeterminations, premiums, all those words we've tried to define for you. And then also one of our handouts has a QR code that links to our website, and on one of those web pages we have all of the DHHS contact information. So if you're looking to contact the Department of Health and Human Services, you can go to your local district office, which we have links to, and then we also have the phone numbers.
We got you off the hook.
And the digital versions of the things that you're seeing here, so if you're in a position where you might want to post some of this information, maybe in your locations or share it with families, all of the digital files are listed in our resources area of the Medicaid Matters website, so you can easily download that and print it in heavily trafficked areas. And I think I came into this 2 months ago as a parent of a child with a disability, and I did not understand how this would apply to him or to myself. And very quickly, once I understood it was a Medicaid expansion population, many of my fears were alleviated. That's the goal, is that people don't misunderstand and that myths can be busted in these formats. But also, all of you are ambassadors for that message too. Like if you're in those communities and people are worried, we're hearing that right now, tonight, that particular population of people does not need to be concerned at this time. We will continue to keep our eye on things and communicate to you if anything changes in that particular population.
Alicia, Kelly had another.
Yeah.
It might be useful to the group and anybody who's online to hear what constitutes work-related activity. Sorry.
Those are
It's not just working, that's why.
Right, it's not just working, it's called the community engagement requirement because it includes working for a wage, volunteering, and being in school for a certain proportion of time. So there are multiple ways to fulfill it. And again, the devil is going to be in the details about how do you demonstrate that you are meeting the requirement, or how do you demonstrate that you are exempt from the requirement? That's going to be the two main things that are going to be impacting the expansion or granted advantage adults.
I think that for those of you who are at the table, no, I don't need a microphone. I think for those of you who are at the table, the woman's question about the kinship program, that's a place to remember to bring this up and say, let's not forget this population of people. And how can this possibly constitute work-related activity?
Right. There's a hot game of something going on back there. Okay, any other questions, comments, rude remarks that you wish to share with the group? Yes, ma'am.
Yeah, providers, what's gonna happen? What's gonna happen at their end? Are they gonna be
So
reimbursed?
there are things that I left off that are happening
Too
to them.
complicated? Okay.
Well,
Not worried.
it's not about, there's things happening to them. They're generally starting in 2027 and 2028.
Okay.
And the bottom line is, between frustrating enrollment, like if someone's not enrolled, they're not covered, then the provider treats someone, they're not guaranteed a payment for that, right? That puts financial pressure on a provider. There are other things in the federal law that also put financial pressure on providers. And all of these things together, more people becoming uninsured because they don't do the right paperwork, or the policy available to them on healthcare.gov is too expensive, or whatever it is. More people being uninsured in general also puts financial pressure on providers, which is why you have folks here tonight from providers who are asking about what are the supports available, but also reminding people that it's in the provider's interest to prevent as many gaps in coverage as possible, and then try to make sure that the people that they see in their offices stay covered. That's another presentation. We'll do that one another time.
I can point you to something that recently we shared from the New Hampshire Fiscal Policy Institute, did a webinar and a very detailed report on the provider change that's coming in 2 years.
Yeah.
And how that will blow a hole in our state budget. And if you want to understand that better, that is also in the resource section, and you can listen to that webinar on your drive to work one day. But it explains exactly how the tax reimbursement is going to shift over the 2-year period approximately, and why that will create such a huge deficit.
Right.
And that's just, it's far out, but if you want to learn about that, I would highly encourage you to watch that webinar. It's a little dry, but really informative.
2027 is going to be complicated because of the changes applied to mostly expansion families. 2028 is when I think providers will really start to feel the financial pinch of the preceding years. the consequences of the procedure.
If people want to advocate, what should they do?
Yeah, Jake, if people want to advocate, what should they do?
So, as you've heard tonight, we're a little bit stifled by the fact that many of these things have already been passed in federal law, and there's very little that we can do about that. That said, I think there are many things that our state government can do to provide cushion to kind of ease the fall here a little bit, to make, to structures that we can put in place to try and help make sure, as Deb said, people hang on to their coverage as best they can, as long as they can. Have these questions that they don't know the answer to create an uncompensated care fund for providers who are losing such revenue, to make sure that they're able to maintain, keep offering the services that they do. I think right now we don't know exactly what those solutions will be, but I do think that there will be things that are on the table, things that we'll be pushing the legislature to do over the next year or two. And we would really love all of you to join us in that effort. I work in Concord, I'm a lobbyist. They don't listen to us lobbyists. They listen to people from the community. They listen to people who are directly impacted by this. And so we would love more than anything to work with you, to capture your story, to be able to demonstrate what Medicaid means to you all and to your community. And so to the extent that you are interested in that and would like to work with us, please pull me aside, pull Alicia, Colleen, and a lot of the people in this room are part of our coalition. Make sure, I hope we got all of your contact information, so you're now on our email list. Beware. There will be emails coming, so directing you to, about what some of the steps that we can take are. But at the most basic level, sharing your story, talking publicly about what Medicaid means to you, to make sure that our lawmakers are aware of what's at stake here is the biggest thing we can do, and we would love to help you do that.
All right, nothing further. Thank you so much for coming. Oh, Colleen, do you have a last minute thing?
Oh, we just wanted to remind people that you can share your story on the website too.
So if you go to New Hampshire Needs Medicaid, you can, there's a
story form.
prompt there to let you share your story.
There's also one if you were impacted by the enhanced premium tax credits going away as part of the Affordable Care Act. If you've been impacted by that and your premiums have gone up, you can. There's a form for that, and then there's a form for Medicaid specifically.
We do have some navigators who've asked where they can point people to who are interested in being enrolled in an advocacy effort. That button, share your experience, is how to get the process started. We'll reach out, and we don't have to share personal information. We can work together to make it anonymous if that's an appropriate step, but we can also go as far as to help you write an op-ed and put it in your local paper, just to keep the conversation.
So you go to New Hampshire Needs Medicaid,
Yep.
and you click on the Share Your Experience button.
Yeah, and that'll get the process started.
If you want to get started in the advocacy process.
Perfect.
And those stories also go to our members of Congress too, because our staff work closely with members of Congress, so that's another avenue.
Yeah, those stories will go far and wide, but they don't have to identify you. They can be completely anonymous. There's no reason for people to share information that they don't feel comfortable sharing. Okay.
Great.
Thank you so much. After dinner time, so it's time for ice cream. So thanks for coming. I'll see you later.